As soon as I found out about the field of public health, I just became enamored with how public health in particular incorporates all different types of disciplines, from medicine to urban planning to epidemiology and research and policy and management, and takes the best of all of these different fields to really improve people's lives. So when I graduated college, I took a job working for Philadelphia's largest Latino social service agency to try and establish a community health center. So I did interviews, surveys, and focus groups of the local community. I just heard story after story about families where if they had had more physical activity, or if they had had the proper nutritional counseling, or if they had just gotten the proper medications, their conditions wouldn't have worsened, or they might have been entirely preventable. After a year and a half of planning, we submitted a grant proposal to the Health Resources and Services Administration, and after waiting 9 long months, we were fortunate enough to be one of 67 grantees in the whole country and one of 2 in Pennsylvania in that round of funding. After working to establish this health center, I decided that I wanted to get a further education in management training. Certainly the School of Public Health is an incredible place for that, and I found a great community here. During my second year at HSPH, I became very involved in the Harvard Journal for Hispanic Policy. This is a journal that is really multidisciplinary. It has students from the Graduate School of Education, the Business School, the Law School, the Kennedy School, and myself in the School of Public Health. And this is an academic journal that's published annually, specifically devoted to cutting-edge issues that affect Latino policy. So in our last journal, we had articles on environmental justice, we had articles on immigration, on health reform. It's been so exciting to be able to engage with some of the brightest minds, not just across the healthcare delivery field, which I love, but also across other fields as well. There's so many inspiring classes that I have taken at HSPH. I mean, you meet students here from all over the world, every single country, and your professors you establish really close relationships with. I was reading a New York Times article yesterday, and a couple of my professors were mentioned. They're the ones who are shaping how the healthcare delivery landscape is, and to be a part of that and to learn from them is such a gift. And ultimately, one day, I think I do see myself in policy, working in Washington, helping to advocate for some of the communities I care most about. You know, I just want to make a difference however I can, and hopefully leave the world a little bit better than what it was before.